Hi, my name is Jennifer Palmer, and I'm the owner of Nourishing Journey. I spent many years dealing with chronic health concerns, and I used to be a computer programmer, and I was told that my health concerns were pretty much the way it was going to be the rest of my life. And I didn't really want to hear that. So I went on a mission trying to find anything and everything that could help me feel better. And not just me, it was for my family too. And I did find some answers. And honestly, I feel better now than I have ever felt my entire life. You can feel this too. People that you know and love can feel this. You can heal. The body knows how to heal. We just need to know how to unlock it. And while none of us have all the answers, many of us have many of the answers. There's many, many, many things you can do to help your body, mind, and spirit. So we're just here to give you some of the different answers. We hope that you enjoy these roundtables. We're going to be covering a lot of different topics. And the goal is just to try to help you see that there's possibilities. But if you think that we can be of service to you, and if there's any way that we can help you, there are links in the description where you can contact us. And we hope to hear from you soon. Enjoy. Well, hi, everybody, and welcome back. Today, we are going to be talking about addiction. And I would love for you to hear more about what our experiences are and what we do to help people with addiction. And maybe you'll learn a few things that you could just do on your own. So this is such a valuable topic, as so many people struggle with this or know somebody who does. So let's go ahead and get started. I'd like to go ahead and start with Lisa Morrel. Can you go ahead and introduce yourself and what you do?
Absolutely. Thank you, Jen. I have worked in the behavioral health field for 30 years, primarily as an addictions counselor. So I understand this topic from that vantage point, as well as in my family, there was addiction. So I understand that also from that angle. And now, of course, as what's known as an ACOA, adult child of alcoholic. So I really have, I think, an in-depth understanding of addiction and the many ways it can manifest.
Wow. Yeah. Okay, Karan, why don't you introduce yourself?
So I'm an oral systemic consultant, and what that means is I work with people on health that pertains to both the oral and the systemic health. So I do a little bit of everything, but my passion is dental, detox, gut, and then another type of detox called human design. And we'll talk about that on another roundtable.
Well, I'd like for you to talk a little bit about that today too, as it relates to any of this as well. Okay?
I will.
All right. Alice, go ahead.
Hi, I'm Alice Tsai. I was originally a pediatrician by training, did that for over 20 years. And then in 2019, started an integrative medical practice. And now I see patients of all ages. I'm just interested in, looking at the root causes of medicine, treating whole people. And so I do the integrative medicine, medical cannabis certifications, homeopathy and holistic medicine. I do see patients with addiction, and I try to take that holistic approach, treating mind, body, spirit, and taking an approach to treating addiction. So I'm excited to chime in today.
Yeah, awesome. I think we have a good group with us today, as we usually do. What I want to start off with is a lot of times when people think of addiction, they think in terms of drug or alcohol, but it can be so much more. So I want to know your idea of what is an addiction truly, because it can be really just about anything. So I want to hear your perspectives on it. And again, starting with Lisa, I'd like to hear what you think, what determines an addiction for you.
Thank you, Jen and everybody. This definition has changed so much even over the years that I've been in the field. My favorite definition, however, goes back to more of an old school one that was out of NIDA, which is the National Institute of Drug Abuse, which is very simple and basic. And that's why I like it, because it can apply to so many things, not just drugs and alcohol, but to many other behaviors that we now call process addictions. So the definition is, despite negative consequences, the person continues to use or to do, the behavior, which could be shopping, gambling, sex, exercise, food, drugs and alcohol, of course. So anything basically that results in a loss of control, and then you see negative consequences attached with it, and the person doesn't self-correct. To me, that's where you see really the basis of an addiction. And that's why it can apply if you're an exerciser and you've got some injuries you really need to let heal, but you cannot give yourself the time and space for your body to do that. That is by definition an addiction.
Wow. Karen and Alice, do you have anything you want to add to that? That pretty much covered it. I don't know.
I mean, it absolutely does cover it. I mean, there's so many trails I could go down off of what Lisa said, because I really agree with her, but I think we'll get into it as we move through things.
Right. And I think what comes to me around all of this is it's like abusive to yourself, right? It's like this self-destructive behavior. And no matter what's happening, you can't seem to get out of it, or you don't want to get out of it. Or even if you try to get out of it, it seems like you just don't. And so we want to really dive into that today. All right. So what do you think could be some of the underlying factors that lead people to addiction?
Lack of self-value and self-worth. And the negative messages that are generated off of those feelings, which often come from, in my opinion, from outside of ourselves. That's where we are programmed to believe those things. And then in my personal experience, that became this snowballed narrative that took me into that world. And it took me a while to unravel what I was and what I wasn't. I was labeled as an alcoholic, but I was not an alcoholic because my problems didn't go away. I stopped drinking, but nothing, I was better when I was drinking, actually. When I was not drinking, I was unable to control my emotions because of the narrative in my head. So for me, it was a lot of self-talk that had to change.
Yeah, I think.
And, and when I was in AA with what Lisa was saying, I was in Japan when I went through all that for a year, and I came home and there were no young people here in AA at that time where I lived. It was all older people who smoked and drank coffee all day. And it wasn't working. I wasn't getting, and so I realized, oh, there's something I'm not getting. I was getting something from these people who were my age, and we all were having this common experience in Japan at the time. So I'm like, well, maybe it's not alcohol. Maybe there's something I'm missing in my life. And then that's what I figured out. And now even thinking about taking a drink, it's, I don't want it anymore. So when I went to AA though, they used to say exactly what Lisa said. If it's causing a problem for you or somebody you love, then it's a problem.
Yeah, that makes total sense.
So the alcohol was a problem, but for me, I think the genetics for addiction was certainly there. And I think had I not been in the right place at the right time, I could have gone down that road, and it could have affected my function. But fortunately, by the grace of God, I was in the right place at the right time.
Well, it's funny that you say all this, because I think a lot of times when people go down the addiction route, they start off because it is helping them. Mm-hmm. Right? Yeah, it is making them function better. That's how it starts. And then it becomes like they can't get past it. They can't really heal it, or they can't stop doing the thing that's actually now starting to harm their liver or harm their kidneys or their lungs or whatever it is, or their bank account, right? Whatever. Or
I think of it like a relationship. When you first get in, you have all those hormones. And when you first start drinking, you're more lively and you talk to people and life is good. And then it all wears off and reality sets in and it just doesn't work like it used to.
Yeah. Well, Alice, what do you have to add to that part of the conversation?
I think, like many things, addiction is a very, very complex thing. and there's genetic components, there's physiologic components, and then what contributes to it is very complex too. And it's going to be different for every person, but there's certainly, like, even you can go, broader to narrow. So there's like, societal things like, unemployment can be linked to it. And then there's the, ACEs, like adverse childhood events, traumas and things like that can link to it. And then there's biological, so we do know with addiction, there is, and it differs depending on the substances, but it does change the wiring and the chemistry in your brain. So what can contribute to it is extremely complex. And then healing it from it is also complex. But I think underlying it is, for many, many people, is there could be trauma. And then what it ultimately is it comes down to that mind-body connection. So it's basically physically, you're feeling something. So, we have feelings, we have anxiety. So your brain works in these different ways. You have this kind of what they call the more reptilian brain, like the emotional parts of it. We have the part of the brain that regulates blood pressure, the brainstem. And then you have this cortex, this wonderful frontal cortex where you can be brilliant and plan and do things. And then everything works together. But if you say have a PTSD, then that emotional brain just kind of, they've done like PET scans. So that emotional brain like just highlights, or say somebody's been in a car accident, then it kind of hijacks. And then it's that part of your brain that is timeless. So it's like, if you were a little child and you had a trauma, then it's timeless. So it's almost like it could be 20 years later and it's still affecting you. So then people will turn to addictions. Like people have different addictions. Some people, might have a TV addiction, like watching TVs, or, sometimes it's drugs or whatever. But it does, like people touched on, it does make you feel better. Like people, we can't ignore that. It's like, oh, you're using this to cope. Well, then in the healing process, it's also complex. You need to treat it at the level of personal, mind, body, spirit, and societal. And it's like, how do you, you don't want to just label it. It's like, how do we figure out what's causing it? And then how do we bring back in that societal connection, that connection to the sense of self, tuning into, how you feel, honoring that, and how to feel better in a way that ultimately addiction is a misguided attempt. Like you're trying to feel better, but how do you feel better in a way that is good to you and also helps the world and helps you to become more of who you are and heal.
Well, and that reminds me too of some of what Karan was saying too. I think sometimes we just have such a lack of self-love, and that the idea of quitting, it's almost like some of us who maybe have addictions, we feel like we deserve it. We deserve to self-destruct, or we're trying to get someone else's attention so maybe they can say that they love us, and so we're self-destructing so they can come rescue us. And there's, like you said, there's so many different aspects. Wow, I don't know, Lisa, what do you want to add to that?
Yeah, thank you. I appreciate everything that's been said. And I agree, it works until it doesn't. But I'll add that my very first job in the field at Johns Hopkins in a methadone clinic, I went to my supervisor and I said, hey, I feel like I'm noticing that like 90% of the people in my caseload have not just trauma, but severe trauma. And so this was way back, like I said, 30 years ago, before the buzzword of TIC, trauma-informed care, got into the behavioral health field. And so, yes, I think it's a very real thing. There's big T trauma, and then there's little t trauma, but trauma is defined by the impact on the individual, not by the incident itself. So that's why trauma is so pervasive and widespread. But it was interesting to me in the field because while I did find and have found that in my work, the majority of people have either big T or little t trauma or an underlying mental health issue, which could be something like low-grade anxiety, dysthymia, low-grade depression, or it can be the big, mental health issues. That is a driver because, as we said, people, it's a coping mechanism that works until it doesn't. And so they proceed down this path. And then what often happens, even in people who don't have one of these underlying risk factors, is what's called learning the mood swing. So let's say you have somebody who actually doesn't have any underlying mental health issue or trauma, but they just start noticing like, wow, this really feels good to unwind in this way. And then they also can fall down the rabbit hole. The brain becomes hijacked and they didn't even have any of the underlying factors. So it's so pervasive. And I want to say about trauma that some of the people that I've worked with, honestly, using substances, even something as addictive and devastating as opiates, for them and what they've endured prior to the addiction was actually a coping mechanism that made sense, as you alluded to, because they had such horrific things that they dealt with in their past that to either face that, let's just say that, suicide was something that was often contemplated. So they were, in a sense, keeping themselves alive with the substance. That's not to say it was a good choice, please hear me, but in the context of what they were grappling with, it made total sense that to numb out was, in their mind, functional.
Somebody once said to me something that you just reminded me of, Lisa, and they said, the things that you're telling me about the reason you're doing these things, it can't be your excuse. It can be your reason, but it cannot be your excuse. And that helped me separate those two things out, because I always felt like I was making excuses, but then I felt like I had to also give a rationale because I'm not this horrible person. And I think what's happened since I went through my episode over 30 years ago, I think there's a lot more compassion among professionals and a lot more understanding about the concept of addiction and what that means. And people are able to see it more as the disease process that it can become, rather than just, oh, well, you're lost, go over there and take some Antabuse or whatever.
Yeah, great ad. Well, I'm curious too about the idea of pleasure seeking. And that's something that Lisa had brought up and as we were going back and forth about what we would like to bring up today, the pleasure seeking. And it got me thinking about things in terms of, sometimes people are like, they're adrenaline junkies or, like they do things that are really dangerous. And it's not just like to overcome a fear. It's like they can't get enough of it. And it's almost like they're trying to, we're in one aspect of addiction is they're trying to numb from life. And another aspect of addiction is like they're trying to find themselves in life or to feel more alive because they feel numb or something. And so it's like, to me, it seems like two opposite things, but they're both self-destructive. So it's like a pendulum, right? So I'm curious what you guys think about that, or if you have any experience with that. And Lisa, I'm going to start with you just because that was something that you brought up.
Thank you. Thank you. I love the question because it's one of the things that I forgot to mention when I was rattling off the unusual or less talked about things we can be addicted to. Screen time was added in, as well as behaviors or activities that are, pleasure seeking, adrenaline junkies. So I'll give an example from my caseload many years ago. I had a young adult male who was a snowboarder. And he had, because you have to practice before you get it, he had a series of concussions. And the doctors had basically told him, sorry, but one more concussion and you're basically at risk of being a vegetable for the rest of your life. Because as Alice alluded to, the brain can obviously only take so much trauma. We all know this. He was on my caseload and just couldn't stop because he was so passionate about his sport. And it's really tough when you're working with someone like that because it did make him feel alive and he was so gifted and talented. So in my role in helping him work with this and trying to figure out where do you go with this, because it was kind of his purpose, but yet ultimately his brain was hijacked in a sense because he needed that to feel alive. And these are the very real things that people with this affliction suffer from, because it's a chicken or the egg, whichever came first. Now he's in a scenario. So does he give up what he loves when what he loves could cause him to lose the rest of his life? And it's a conundrum with no easy answers.
So did you ever work that out? Did he ever work that out when he was with you, Lisa?
It was a process. He was referred to me for something else, for a DWI. So that treatment, he was only there for a short period of time. So sometimes all you can do is plant seeds. The decision was ultimately up to him. But at that age, and also what Alice referred to, we know that addiction damages the part of the brain involved in decision making, the prefrontal cortex, logic. And so, number one, he's a young adult, so his prefrontal cortex is not fully developed. Secondly, it's been damaged by the drinking he was doing. And then thirdly, it was damaged by concussions. So whether or not he even had the wherewithal to make the best decision for himself was, really up in the air. So he left after about 8 weeks, was discharged successfully from the DWI program. I don't know what he chose.
Well, I asked because I have personal experience with that. My youngest is a BMXer, and he's had 3 serious concussions and 1 minor concussion, and he was told the same thing. And I attempted to take his bike away, but the problem is the drugs. That's when the drugs kicked in. I mean, his anxiety went through the roof. And if he's not on a bike, he's anxious. And so, I've had to live with this fear, really, because what all that can mean. But he rolled his car. He totaled his car on the freeway, and it wasn't his fault. It wasn't drinking. It was 9 o'clock in the morning going to work. And then right after that, he broke his foot and he had to be off his bike for over 9 months. And sometimes I think the universe comes in and saves us because, now he's up at school and in Whistler and he's doing his thing, and he's really, he's not using, he's drinking some, but he's a young kid. So, but, it is tough. And I think about the family too, because we have to talk about that whenever we talk about addiction. And it's really tough to watch somebody going through that when if you take that thing away from them, like, and kids, if you take their screen time away, they have like complete meltdowns. I kind of have a meltdown if it gets taken away from me too, to be honest with you. I might have a problem I'm discovering right here at this round table.
That is so funny.
Well, yeah, the electricity went out when we had that little tornado here last night. And I was like, oh my God, because I was right in the middle of doing something I was interested in. And I didn't know what to do with myself for a few minutes there.
I have to say I had that minute too the other day. Like, I think it was Friday night. We had some storms rolling in, and the electric went out for a little bit, and the internet went out for a little bit. So it's like you couldn't get on the internet to do anything if I wanted to work or enjoy myself or anything. So I had to sit there and be like, okay, now what?
Yeah, you do realize how many things, like, we don't know what to do with ourselves if we do not have our screen time sometimes.
I'd like to add one brief thing you reminded me of from saying that, Karen. They did a really cool study where they looked at Tibetan monks and their chanting. So of course they chant for literally hours a day. And they asked them for a period of time, maybe a month, to not chant. And then they did the PET scans and they measured what was going on in the brains. And all of the monks that were, in the study that were used to chanting showed levels that would be associated with depression when they weren't allowed to chant. So it just speaks to how our brains and our bodies do get, dependent on these things that we do to feel alive, to have that peak experience. So I think we can use that understanding to broaden our compassion as we treat individuals suffering from this.
Wow, that's fascinating. Yeah.
It is. And that reminds me of something that I heard somebody say. He's a chronologist that I listen to, and he's not talking about addiction or anything like that, but he talks about how the ideal way to function and to manifest what you want in your life instead of what you don't want is to break pattern. Like every day, break a pattern, because a lot of us are creatures of habit. We get up, this is what we do. He said, I don't care if you turn around and crawl out of bed backwards. He's like, but if you are stuck in a rut, if you can't stop doing something, then you need to break a pattern and do something different, because he says that there are all kinds of energies around us. And if they know what our pattern is, they keep pinging us constantly. But when we break pattern, those energies are confused.
Oh, I love that.
I like that too.
Well, I want to get more into that in just a minute, but before we move on into like things that might help, I want to talk a little bit more about pain and stress, because I think those are two big things where when there is not necessarily a trauma involved, although pain might include a trauma, like a physical trauma, but sometimes, pain is like just arthritis or it's something else that you're going through, and stress. So much of addiction comes from pain and stress. So is there anything you want to add about any of that?
I mean, I don't want to take up all the time talking, but I've had that experience too, because I had intense pain and they didn't know what to do with me. And so they put me on fentanyl, and I was on high dose fentanyl, and I was on a patch with lollipops. And I didn't know what it was doing to me. Everybody around me, I mean, I feel bad about what I did to everybody around me, because I really was not in my right mind at all, and basically non-functional. And I met an acupuncturist, and when we took the patches and stuff off, I had a really tough time, but it didn't change my pain. That's what I realized, that it took the edge off, so I didn't care as much, but it didn't really change the sensation of pain that I was having after the first few weeks. But by then the addiction was there. And of course, there's the stress of just getting the drugs, and knowing that you want more. Like I would eat one of those lollipops every 4 hours. And so that's when I knew the addictive gene is still there for me. I mean, that stuff is powerful. So yeah, I think the stress and pain, like I know several people who, they've never had a problem with alcohol or drugs. And the minute they've developed the pain and they get put on the drugs, that's it, So I don't know, Lisa and Dr. Tsai could probably speak to that more, because clinically they probably see that stuff more than I do. But my experience with it left me with a pretty bad taste in my mouth about narcotics for pain, unless and fentanyl, that really should be more for terminal types of pain, not for somebody who's in their 40s.
Yeah. And Alice, I'd like you to talk a little bit more about that, as well as cannabis, because you do the cannabis certification, and anything else you want to talk about around just managing pain, or what cannabis might be helpful for. And then how do you navigate addiction with all of that? And what are the differences?
Oh, thank you. I think with pain, one way to reframe it is, like a traditional kind of allopathic approach to pain would be, let's get rid of it, right? So people will be like, I have this headache, let me take some ibuprofen, let's get rid of that pain. But another approach is that when you have this pain, it's a signal. So like the check engine light on your car. So if you had pain from touching a hot stove, maybe that's a warning for you to pay attention to it and do something. So one is maybe reframing our approach to pain, and then that can help, because certainly nobody likes to feel pain. I myself get migraines and headaches. So part of and certainly, taking an ibuprofen would help me. But part of the approach is, hey, what's causing this? So is it stress? Like definitely trying to do a lot of stuff that'll bring on a migraine. Am I dehydrated? And then there's also levels of what you can, so one is looking at the whole scenario, like, it's like, do you have a gluten sensitivity? And that's, triggering it, some kind of food sensitivity. Well, certainly you could continue to keep taking a lot of Tylenol and ibuprofen, but those can have side effects. Tylenol too much can hurt the liver, and ibuprofen can have cardiac and kidney. So it's like they're good if needed to bring relief, but can we figure out what's causing it? And then also, are there treatments to treat the pain that can be safer? So, a lot of people, maybe they have like a hip pain and you could get like a hip replacement, but then there's also many, many things like diet, nutrition, lifestyle, or even natural treatments like turmeric that's anti-inflammatory. Homeopathy can be really great too, and I love it because it's so safe. So that approach to pain, and then in terms of the for the treatment, I do want to mention like the opiate, epidemic. So this is like in a grander scale of things of why that happened. So it was because, people were in pain, and then doctors could prescribe, opiates or say benzodiazepines, to help with sleep. But the concern is that, number one, they can be good, for like a short-term kind of thing, but it's not really meant to be long-term. And in the long term, for chronic pain, opiates are not that great anyway. And they're, highly addictive. The other concern with them is that they have action on your brainstem, so the respiratory and cardiovascular system, suppressing it. So there's that risk, there's that therapeutic window where you want pain relief, but if you get too high, you get side effects, which could include stopping breathing, which leads to death, which is bad. So it's like,
A little bit.
certain people may, where you cross into that addiction, and there can be familial genetic, it's very complex, some people are more prone to it, but it's like, if they get into that addiction, and then say it's not just physical, we're really just whole complex beings, mind, body, spirit too. So it's like there's the physical aspect, but there's also that emotional aspect. So, if somebody starts off treating a physical pain, well, that's like a whole nother story too, like your back pain, there could be physical things, but it could be emotional things contributing to it too. But it's like you start off treating that, but then maybe you're using the opiates to help your emotional pain. But then there's that therapeutic window where some people do accidentally, die, from opiate. They weren't intending to. So then that's where I started my interesting start of my practice, where I purchased the practice of somebody who used to see patients at Nourishing Journey for medical cannabis. And that's how I got into doing that, because she asked me, she was in my homeopathy class, and she was like, hey, she was a nurse practitioner, and she said, Alice, do you want to take over my medical cannabis practice? And me as a pediatrician, everything I'd heard, I was like, what? So then, but I said, I'm open-minded. I just like to research things. So I looked into the science of it, and I found out, oh, there's, scientific things where medical cannabis is this plant that's been around for thousands of years. And it has cannabinoids, terpenes, and things that can be anti-inflammatory, can be helpful for pain and mood and sleep and all kinds of things. And the advantage of it is that it has a pretty high safety profile, not like it's perfect, it does have addictive potential. It certainly can have, negative effects, but in terms of the addictiveness, it's less than opiates and benzodiazepines. In terms of the side effect profile, it doesn't act on the brainstem, so it doesn't suppress the breathing like the way the opiates can. And then tying it into this opiate epidemic, it's like, hey, how do we miss out on this whole other step of, treating pain, where people go straight to opiates it's like this can be really, really effective, when used in a, reasonable way. So that's how I looked into it, and I said, hey, I can help people. And then along with the holistic approach that I like to bring, and that's why I really have loved it, doing that's just part of what I do, the medical cannabis certifications, but I have enjoyed it.
Yeah, I think that's important. Sometimes we have to take interventions, and the safer ones are always best to try first, than diving into something so extreme as opiates. Yeah, I agree. Well, and I want to talk, if
May
you
I add just
can,
a couple of thoughts?
yeah, please.
Thanks. Yeah, I appreciate everything that Alice said, and I think she really covered it. In terms of my work as an addictions counselor, I just wanted to echo that I typically would see patients that would get into the mindset of they want that, that quick fix. They want to treat the symptoms and not the underlying cause, which Alice did a great job of covering all the various things that can contribute to it, including the mental health and the not physical causes. But part of it is, systemically or culturally, we live in this, pop a pill culture in the United States that's reinforced by the media and advertising. So even if you don't have that underlying genetic predisposition, everything else in our culture is kind of pushing us in that direction. But you can tell I really like Alice research and studies, because they did another study specific to this topic of people who end up going towards opiates for pain. And they found that people often with that choice end up having a lower threshold or tolerance for pain. So I just want to mention that there is that genetic component in there as well that makes somebody potentially even more at risk for it.
It's funny. One time I had a recent issue where I was carrying a laundry basket, but it has a wire rim around it. And I was in a hurry, so I was rushing to get the laundry out of my bedroom and over towards the laundry. And I jammed my shin into the wire against the door frame. And
Ouch.
it hurt like crazy. I was like, I couldn't walk. And I was like, when you get so hurt so bad that you can't even like breathe or make a noise, I was like, oh my gosh, I know. It was crazy. But I was like, wait a minute. Pain is just an energy. And I'm going to be okay with this. No, it's fine. All right, body, you got it. We can let go of that trauma. We don't need to hold on to the pain. And within 5 seconds, it was totally gone. And I was like, man, that is going to bruise so bad. And it didn't bruise. I had no pain after that. And it was so painful. I swore I was going to have like a big old goose egg on my shin. And so when you're talking about like the pain tolerance, a lot of it is mindset.
Yeah, the Buddha said, and then there was pain, meaning like we can take ourselves outside of that equation and be the observer. Tough to do, but.
Yes.
Well, I want to mention something off of what Lisa said too.
Go ahead.
Like that the other thing about the cannabis is that it can actually be used to help with opiate addiction. So, some people have used, I think healer Dustin Sulak, he's a cannabis clinician. He did a study and with his patients where it's synergistic. So with the opiates, you can actually use less, and with cannabis together, it can still help with the pain. And then it can be used to help either decrease the dose of opiates or help even with help patients with weaning off opiates. So it can be really helpful in that time frame, in that kind of scenario too. Because I did talk to a patient once who I think was using opiates to help with the pain, like a severe kind of pain injury situation. But then their physician kind of was like, because there was the opiate epidemic, and then they cracked down on physicians. So then physicians are like, no, we're not going to write you opiates. But then the patients are left like their doctors refusing to write for them and they're suffering. So it's like, I thought that was the situation with this patient. So I really, felt for the patient too, that's kind of a hard type of situation. So definitely, I'm interested in, hoping to help people with their pain, and healing with addictions.
Absolutely. I think that's fantastic. I want to talk more too about the effects of addiction, the effects on the body itself. I mean, we all know addiction can wreck your lives, but I want to talk more specifically, especially with Karan and Alice, about what it does to your body. But then also with Lisa, what it does to the family and friends, like your supportive foundational structure around you, and what you have seen. So let's start with Karan. If you can talk about your understanding about what addictions can do, especially like drinking and drugs and things like that, cigarettes. What does it do to the body? The toxic burden. What does it do to the organs? What might somebody be noticing in the beginning versus maybe more later stages of addiction? What are some warning signs that you think people ought to start paying attention to?
I mean, I think in terms of what it does to the body, and Alice may speak better to this than I can, but I think it really depends on the drug of choice. Obviously with alcohol, you're looking at the liver, you're looking at the gut, you wipe out your biome, you've got all manner of problems. And so it almost feels like there's this thread where each addiction affects a part of the body, but then because we're a whole person, it's body, mind, spirit. So eventually there's this domino effect where everything is affected. Obviously detox is really important. And because, you have kind of a bifurcated system in the body for detoxification, where you've got downstream circulating toxins, and then you have the upstream detoxins. Why do I keep saying detoxins? That's ridiculous. I must have myself say this, and my brain is going, what am I now? No, I'm just kidding. So, if you have all these toxins that are downstream and circulating, and your body is having to park them upstream because your vital organs need to survive to do the other functions, then you're going to end up with your nervous system very impacted. And that can be your brain, but you also have the vagus nerve that runs from your brain to your gut. And I don't know a lot about this. This is a course that I'd like to take with this doctor who is actually using amino acid therapy for addiction. And Lisa, you probably know about this. But I know that for me, I carried the same, we change slowly and things happen. So I'm not the same person I was back then, but I still have my narrative. And I almost feel like that narrative can be an addiction as well. And I was even going to ask Lisa, when you start talking, Lisa, if you maybe could address this, when you're working with someone who doesn't seem to have an issue, they go on opiates, and then they have the problems being addicted, do you feel like it's truly always helping with the pain, or do you feel like what that's doing is numbing some of the trauma? Because a lot of times when we have pain, we can't do our normal activities. And I know for me, I had a lot more time to think about my past and the things that I was bitter about or frustrated about or whatever. And so I think that for me, that's what the drugs were numbing when I was on them. But in terms of what I do, I don't work with people. If they have an alcohol or any kind of addiction problem, I will work with them. But the work I do is not specific to the addiction other than narrative, because I think the human design is one of the best things that we can do for ourselves in terms of changing that internal narrative and starting to block out what society has told us about who we are and how we should be, and to help us get back into our body and listen to our own voice and manage ourselves from that perspective. And to me, that inner voice is the root cause of any choice we make. If we listen to the voice that's kind of looking out for us, then we're going to make decent choices. But if we let those other voices come in, we don't. So I think that definitely that if you've got somebody who's dealing with addiction, you've got to do an evaluation, and you've got to look at the organ systems as well. And you've got to look at the brain, and it's like the treatment's almost as complex as the reason somebody would but would be addicted to something, right? Because you've got to look at what that is. And for me, it was my messaging. It was my own personal branding. And then it was the pain. So both of those things required a very different type of treatment for me. But I'd really like to hear more about the amino acids from Lisa and Dr. Tsai, if they know about that.
All right, so who would like to talk next, Lisa or Alice?
I can go, but I feel like Alice, it's up to you.
Go ahead, Lisa.
I'm sorry?
I was go ahead, Lisa, and then Alice.
Yeah, go ahead. I don't know too much about the amino acids.
So I'll start with that. Yes, I studied in California with a doctor by the name of Julia Ross. She's actually been around, I believe she did her work starting in the 70s, and it only began to kind of filter its way into the addictions field in maybe the 90s. I took the course many years after that, but very briefly, when you're looking at the brain, of course, everything involved in the brain, as Alice said early on, the brain becomes hijacked. And so we know that that's going to affect the neurotransmitters as well. So like you have the cannabinoid system, there's also GABA and all the different neurotransmitters, dopamine, serotonin. And so we tend to think that you need, Prozac and Zoloft and this and that. And there's a place for those psychoactive, psychotropic drugs, yes. But for me, being a holistic health counselor, I like to start with the natural approaches holistically, seeing if gently encouraging the body through diet, nutrition, and neurotransmitters fortifying the brain can cause positive changes before you go, for me, to that last ditch approach. So I encourage everybody in this field to become more well-versed with the neurotransmitters and the work of people like Dr. Julia Ross. I believe since then, she's not the only one doing that, but it's really good stuff. And there's a lot of studies showing that it's effective. It's just not as well known because, we live in a culture that's really influenced by big pharma and things like that. And I always want to say there's a place for that, but I like to start with the holistic approaches first, because I believe most people, given the right set of tools, can respond in that fashion. And Karen, you made a great statement saying how complicated not just the reasons for becoming addicted, but then healing that are. So I kind of feel like you need all these different tools in your toolbox. So I will stop with that and give Alice a chance to weigh in.
Well, thank
If
you,
I could just
Lisa.
go back. Oh, sorry, can I just go back to the amino acids for a minute? Because I just want to say that the reason I asked you about that is once I attended the masterclass with this woman, I started taking amino acids. And that actually, my nervous system had not been normal forever, but after the Lyme disease and being on all the fentanyl, I had a very quick reaction to things. Like really didn't feel like I could control it. And the amino acids completely took that away. I'm able to take in stuff now and actually keep my mouth shut sometimes. And not blow the day up because I've been impulsive. And so I do think they have some value when there's a nervous system is involved.
Yeah, I've seen that as well. I can totally attest to that. Yep. In myself and in clients. Yeah. For both depression and anxiety. Yeah. Yeah. All right, go ahead, Alice. I'm sorry.
No, I
Sorry,
wanted to
Alice.
thank Lisa because I was like, when you were talking, it just triggered in me that I completed certification in Walsh. William Walsh is somebody who does nutrient therapy approach. and his person that he worked with was Carl Pfeiffer. So I completed that certification, and it's nutrient therapies for the treatment of mental health disorder. I was like, oh, why did I forget that? So I was like, what it is it's a very cool program, because it looks at mental health disorders like bipolar disease, depression, anxiety, ADHD, and then looks at how specific nutrients. So there's a specific testing protocol where you can look at certain nutrients like copper and zinc, and and then pyrroles and things like that, and then assess. So basically the idea is like bipolar, depression, anxiety. It may not be one simple thing. It may be a different thing in different people. So you do the testing and the interview to figure out what's the underlying condition. And it could tie to your serotonin, like depression often is low serotonin, or in ADHD, it's like, inability to focus, or, that there might be too much epinephrine, fueling too much energy. And then if you understand the specific person's, what's causing the problem, then there are certain nutrients that can help that. And so I did learn that. And then that's definitely very cool thing.
Well, I want to talk real quickly before we really dive more into things that maybe people could try or to consider, and maybe even bring up to their doctors or whoever they're working with. I do want to talk about the impact to those around us. I want, that the social impact of what's happening to families and or loved ones and things that you're seeing. So Lisa, go ahead and talk about that.
It's hard to even describe the effects. They're incalculable. I can say that firsthand from having addiction in my family, and then of course from working with all the people, the patients and their families. But at the very least, it strains relationships and erodes trust. But one of the things that you will find with addiction in families is that always it creates a toxic, dysfunctional environment for not just the addict, but the entire family. So what happens is the development of roles where the addict is in the center, and then everybody takes their role, and they're very predictable. That's why you can research this on the web or read books about it. Because it's very predictable. But there's the addict, and then there's the person who's helping by being the enabler. And then depending on how many other people are in the system, they all take on a role. And the really sad thing is that none of the roles serve anybody in the system. Even if you have like a high achiever, the hero child, they might be an overachiever and have a lot of accolades and achievements, but there are underlying issues that if you scratch deeply enough underneath the surface, you will see. And none of these roles serve the individual. They all are bred to serve the addiction. And so even if you take the addicted person out, the other remaining individuals who have stepped into that role and lived in that role still need treatment at some point in their lives to really integrate what they've been through and understand the impact on their life. And the system is always stronger than any individual. So if you take one person out of that system, in that system, the system will just adjust to continue until people have interrupted the pattern, like Karan alluded to. So it's pervasive, and it affects people deeply, and it can take years to heal if you don't have the proper techniques in place, because it is tricky, like we're talking about. I mean, it's like the onion, you're unpeeling the layers.
Well, you said something about, the going deeper and really scratching beneath the surface. And I had in my notes, actually, as you guys were talking, I was like, we need to talk about the idea of superficiality, because I think as a society, we tend to be very superficial. We don't like to go deep. We don't like to feel deeply. We shove everything underneath of I don't know, deep down into our bowels because we're like, I am never going to look at this again. And I'm just going to be happy. Things are okay. Right. and I see that a lot in the spiritual community too. And they call that spiritual bypassing, where you bypass the deeper feelings of things. And but that brings me to this whole idea of like, and I don't mean this as a blame or shame kind of thing, which I think a lot of people take it this way, but the idea of the victim stance, the victimization, being in victim, and when something happens to us and the way we see the world through those eyes versus getting empowered. So one of the things that I know I talk to people about a lot is, how do you get out of this victim space and into a space of empowerment? And especially when it's the traumas that aren't as impactful, either they're lesser traumas, it's a lot easier to do than with the harder traumas, the more difficult things where it's the victimization is so difficult. But a lot of things are like, I think the stress of our environments and our superficiality is we get victimized, and then we have all these layers of things that have happened to us that we never clear, we never heal through. And then we just try to overcome it by jumping onto some sort of an addiction or addictive behavior. And so I think that's a brilliant thing to talk about. And I know that, in counseling, it is about going deep, and it's going within and figuring things out. But, I don't think everybody always needs to necessarily go to a professional, because I think that holds people back sometimes. They don't want other people to know their baggage. And so people are afraid of that. And so they just don't go. And that's why the help book industry is so big, right? Because everyone's trying to do the self-help thing, which I don't think is a bad thing, but it might be a good place to start to get you to open up into what's underneath of that rug or what's in the bowels of your being. But, what else do you guys have to say about that? Like, where's the value in that for you and in what you do? Go ahead, Alice.
Oh, thank you, Jennifer. What you were speaking about was really, really beautiful. And I think it brings back to the feeling, I think it was, since Lisa was talking about Buddha, it's like that he talks about suffering, so that's the human condition, is suffering. I think none of us, nobody, no being does not suffer. So if we want to talk about pain, then that's really what the traumas that we've gone through, the pain could be horrific, whatever. Or even when I think of, pains that I've gone through, in retrospect, at the time, it wasn't really that fun.
Right?
But it's like, I don't know who said this quote, but it's like, with pain, the only way is through. So it's like, whatever you've gone through, if you just want to try to pretend it's not there, because that emotional part, that part of your brain is timeless. So it's like, I think that fuels into addiction, right? People don't want to feel that. So then that's why you do the addictions, because the things we go through are horrible. Whereas like I talk to my patients and I'm like, oh, you dear poor thing. It's like, then I feel for them. So then it's like, so then there's this concept of post-traumatic growth. So it's like my sister, in 2011, she had breast cancer. And so it was very traumatic for her, like everything she went through, the treatments, very traumatic for me too. It was like, but then since then, she's completely changed her diet, very healthy. She's become a master Qigong teacher. She's my teacher. So just like that, she's done amazing things. And then, we live nearby, so it's like she had the breast cancer. It was very traumatic what she went through, but, she's living a beautiful life now. So it's like post-traumatic growth. So it's like this human, this potential for suffering is so deep, but we also have so much hope and so much. So it's to go in that direction for healing, for addiction. Yeah.
I want to add to that with, because I teach about this in a spiritual point of view all the time. And I would say suffering is what gets us motivated. The greater the catalyst, the further the catapult. But so many times people stay stuck in that energy of, or perspective of, these things are happening to me. And that's what I mean by the victim perspective. These things are happening to me and I have no power or control over it. And I think that's often what leads people into these addictions. But well, what I want to do now is I want to step into, how do we get more empowered? Because that to me really is the idea of, how do you move past or through this idea of addiction and what people might be going through, whether they're, more superficially addicted, or maybe it's more of a deep-rooted thing. Either way, the only way is through, 100%. So what are some things in your eyes that you have seen have really helped, or been through that have really helped with any type of addictive behavior? Lisa, why don't I start with you?
Sure. I have seen, the good news is that there are so many tools, and many of the tools work on lots of levels, because again, trauma can be stored in the body if that's the root cause. So on the cognitive level, you've got things like cognitive behavioral therapy and, mind-body stress reduction. But then you can go into things like yoga, which can be very effective. Somatic experiencing, which is a tool used in therapy from the 70s. Peter Levine, been around a long time, addresses the stored trauma in the body, as well as something called rapid resolution technique, which is also very effective and quick. You've got EMDR, which is very effective. And then you've got things like EFT, emotional freedom technique, or tapping, which back when I found out about it in the early 2000s was considered very like woo-woo and out there. Now it's very much accepted, and it's based on, tapping in a certain sequence. It's very simple, it's free, you can teach yourself, and it's based on the same principles as acupuncture. So it's like acupressure because you tap on the meridians. So there's just an unbelievable amount of resources to help the individual. And of course, counseling, which I strongly believe in, but I don't think it's any one thing. And then you've got diet, nutrition, amino acids, and all the other methods that we've talked about today. So it's like an arsenal.
Beautiful. Karen, do you have anything you want to add?
Yeah, I mean, there is something I wanted to add, and it kind of ties into the treatment, because what I notice that happens a lot of times is you have the person who desperately, they realize, okay, I'm having this issue and I got to stop. But when you talk about the family constellation or the friend constellation and they try to stop, it doesn't stop for the other people. They're still in their role, and it becomes more difficult for the addict to stop, because the people who have been playing their role, they haven't changed anything. And so this person's dealing with a ton of swirling stuff. Well, what do I treat first? What do I do first? And so I do think that working with someone like Lisa or even Alice, who's, specializing in addiction, is a great place to start. But I also think that sometimes people, like if somebody's like really malnourished and you can tell that their biochemistry is not functioning, then they need to be on some kind of detox. Because a lot of times when, at least what I've heard is when people talk detox, it's just you stop drinking, you detox the alcohol, you stop the drug, you detox the drug, but you also have to repair the damage in the body, which is why I think the cellular repair and getting the gut organisms back in the body so that the body can start to function and you have all the enzymes and nutrients and hormones to nourish your nervous system and your brain so that you can gain a little control. And maybe so you don't have the cravings if that's what it's coming from, because I do think that a lack of nutrition can also contribute to those cravings. So on my end, what I offer is I, do the cellular repair part, the downstream detox, the upstream detox. And then there's something else that I didn't mention, which is, and the type that I do, I would not start somebody there. I do a remote BioResonance, but the company that I work with, they're out in Utah, and they have a device called Theta. And they're contracted with multiple treatment centers out there who send their clients over to this theta machine, and it just is miraculous for people who keep having relapses. And so there's a type of bioresonance that works. And then of course the human design would come later. I think you've got to get the person free of the drugs and alcohol. You've got to get their brain thinking straight, or whatever the addiction is. You got to get them thinking a little bit straighter. But once they do that, then they can dive into the self and, how do I start deconditioning this program that's been running my life forever?
Great. Alice, anything to add?
Oh, and I wanted to mention also, I forgot, Dolores didn't join us today, but there's also some IV therapies that can be really useful in the beginning in terms of detox and fluids and that type of thing. So that's available at Nourishing Journeys as well.
Yeah, and I know a lot of times, I wasn't quite getting into supplements yet, but a lot of times IV therapy can be more easily utilized by the body than taking supplements, especially if the gut and the digestion is messed up. So IV therapy, that's why that's so valuable to people who where they're compromised in their digestive ability. But yeah. All right, Alice, anything you want to add?
I just wanted to add to that it's helpful to hear what other people are saying, because it like reminds me of things. So it's in terms of addiction, which is often tied to like anxiety or depression, that that mind-body connection. So like physical things can actually contribute to anxiety and depression. So, there's the mention of head traumas. Sometimes people can have head trauma, which is actually a physical injury to the brain. And then there's also toxicities, which, that's another roundtable. So, but like certainly like mercury, heavy metal, different kind of toxicities can affect the brain. So there's definitely physical things as well. So as you heal from addictions, really this holistic treatment, lifestyle, even your social support, addressing all of those, and even specific ones like, alcohol can make you likely to not absorb nutrients very well. So many alcoholics can have like a B1 thiamine deficiency. You primarily use your liver as the main detoxifier, and people can get really poor liver function if you're cirrhosis, or, if your liver is really having to manage alcohol with that. So improving the physical health and the whole lifestyle health can also help with addiction. And I think the other thing that someone reminded, Lisa, I think was talking, or Jennifer, you guys were reminding me that the addiction is also not just the person. So like with Alcohol Anonymous, there's also Al-Anon, for the family members. So it is, that was a really great reminder that, it's this system. And if you really look, there's familial, right? There's generationally passed kind of traumas and things. So in a way, some addiction is habitual, it's just kind of going into this road. And so when the person is, I think it takes tremendous courage, and really healing from the addiction really has to come from that person. So it doesn't really come from outside. It's the person themselves has to be ready. So, as the provider, if I'm seeing a patient, I can't make them change. I can't make my loved one change. It has to be something from within that person. But so it takes tremendous courage. But the cool thing is that, I believe it can heal on so many levels, like it's like I think we were talking about how it affects people. So, if someone's an addict, how does that affect their child? And this is near to my heart as a pediatrician, that's what I loved, getting early and being able to instill healthy stuff to prevent. So it's like an alcoholic, how does that affect that child and their children? Well, if you heal it, then that has so many ramifications, now I can't talk, ramifications through the generations. So that too. Yeah. So definitely, you know.
Well, it's interesting in the work that I do with energy healing, we look at ancestral patterns like that. And I link it a lot of times to there can be ancestral karma and things associated. So a lot of times addiction and things like that, it can be associated to an ancestral karma. And but not only that, but you know, in the DNA and genetically speaking, it does get passed down. But what I've seen is that, you know, when things like that are in a pattern throughout the ancestral lineage, it gets brought into a specific person who has the power and the strength to be able to overcome. But what I often find is that they just don't see it within themselves. They don't see their empowerment, which is why I feel like really getting empowered is so important, you know, realizing that you can do it and you don't have to be a victim to the addiction anymore. Right. And, but a lot of it has to start with your mindset. It has to do with making that choice every day. You have to know your why. You have to know that deep reason why you're done. And you cannot have any more reasons or excuses to ever turn back to it, ever, 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 ever. And the minute you do, you have to choose not to. And that's the overcoming of, you know, some people say you have an angel and then you have the devil, right, on each shoulder, which, you know, I do think maybe that's real. I don't know, because there are entities that really want us to be addicted to things and they feed it. And so you're going to have a little voice that says, all right, now go drink that drink or go do that thing. And then the other part of you is like, no, I don't really want that. And the other one's like, yes, 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 you do. Yes, you do. It's been a tough day. You know, just go do it today. You can start again tomorrow. Right. And so you make these excuses or these reasons why, well, it's okay today. And then 10 years later, you're still doing the same thing. And so it's a choice, and it's a hard choice every day, but it is a choice to not take part in that same behavior. Like Karan was saying, change it up. But it's a choice to do it. And you have to remind yourself. And sometimes it's such a pattern of behavior that you associate it with feeling good or feeling better. And so then you have to find other ways to feel good and feel better, whether it's meditation or energy healing or massage or, I don't know, getting up on a different side of the bed or, you know, whatever it is, you know, but where you can retrain yourself. To me, that commitment to yourself is where it starts. If you have not committed to yourself that you're going to do this, and that you know you have it within you to overcome it because you are in this space, right? Because I really do believe that we choose our battles as souls. And, you know, if you think that way, then it empowers you to really understand that if you chose that as a battle for this experience in this lifetime, then you're going to want to come in with the strength to be able to overcome it or to work through it, walk through it. And so I feel like when we have a battle that we're facing within or without, we come with the necessary tools. We come with the energy needed to do the job. And I think, you know, just like people say, God doesn't give us anything more than we can handle. I really do believe that on a very deep level. But the first thing is we need to commit to that and find our power. So with that in mind, and anything else that you might like to say to anybody watching, do you have any final recommendations or points you want to get across?
I have one. In reference to everything you just said and all the tools that have been mentioned to help individuals, I don't think we can overstate enough the power of community and the help of our loved ones and social support. Alice referenced Al-Anon, which is a great tool. Of course, there's the AA and NA community, but what that basically is, you know, the power of letting yourself be helped and the power of connection. And one of the things about social media is they're proving we're more connected, but we're actually feeling more isolated and lonely than ever because screens aren't the same as going for a walk with a good friend or sitting down over a cup of coffee. So that power of social support, particularly as you referenced, Jen, you know, in the first 3 months to 120 days, what they reference as early recovery when you're healing from addiction, your brain and your body has been hijacked. There's so much healing that's taking place in terms of, the brain recalibrating, the neurotransmitters, the nutritional deficits, the damage that's been done. So during that time, you're not as well equipped to make that right choice that you referenced every day, Jennifer. So to have people, whether it's a peer helping you or it's somebody in the AANA community or just a loved one, but to be open to that support to help you along, hold your hand until your brain and your body is back on track, helping you make the best decisions for yourself. And that honestly can take a while. It can take a good 3 to 4 months. And I see that. I mention it because I see it time and time again over the 30 years of working with addicted individuals. I see a radical shift in the way that they think. The negativity, the stinking thinking starts to clear after about 120 days. So to be open to that support early on is so key.
Absolutely. Alice, did you have
And
something? Yeah.
I want to add into that what Lisa was saying, that the brain is the addiction is, there's a part of the brain that gets that dopamine hit. So even sugar can be addictive. And then you get into these patterns where you wire these things in your brain. But the exciting thing is that your brain is plastic. So there's neuroplasticity. So you can set up new wiring. So it is hard, but Jennifer mentioned it. It's like, yes, you do feel good, but with the addiction, but it's like a false good because really it's hurting you in the long run. So if you can do those, like nature is wonderful. Like, I think that the Japanese have found healing powers in just walking in the forest, grounding. So the sun. So just finding those, and then definitely reiterate that connection, like how important that is. And it's especially challenging, that the media and the screens have their positives, but we really need to, put it in the correct amount, because with too much, it doesn't foster that human connection. Just that there is that neuroplasticity, and it's hard at first, but you can set those new wires going, and that there is that potential to heal from addiction.
Right, Karen, is there
So
anything
hope.
you'd like to say?
Well, I'm laughing at myself a little bit because I did something to myself a few weeks ago when Alice talked about the dopamine hit. That's what was happening to me anyway. My grandmother had potatoes at every meal, and I was very close to her, and I miss her terribly. And I can't really eat potatoes because I can't eat just one. I mean, Lay's potato chips, that's not just a line, that's a real thing. You cannot eat just one. And so I gave up the chips and stuff. And I had not had potato in a long time. And I found organic potatoes in this tiny little no place town that I live in now. And I was like, oh my gosh, organic potatoes. Well, I was like, because I'm highly sensitive to glyphosate. And that's the other thing with people who are drinking. I have a client who I'm working with who she's not, well, I can't say she's an alcoholic, but she self-identifies as somebody who needs to tamp down she's functional, but her drinking is affecting her and her health and her life. And so she said, but I eat really healthy. I don't eat any glyphosate or anything. And I said, honey, there's glyphosate all in the alcohol that you're drinking because it's all grains. And she's like, oh my gosh, I never thought about that. And so I talked to her about 3 weeks later, and she said, you know what? I've only had 2 drinks since we talked. But she was drinking every day. So for her, just learning the health reason, that was enough. And I think there's a lot of women out there like that who are still functional, but they're just I mean, I've known them, and we used to call them closet drinkers. They'd have a few drinks out, but if you went to their house, they'd drink 3 or 4 bottles of wine while you were there. And so when I found these potatoes, I had one and I felt great. So a few days later, I had another one and I felt great. And then I had one every day for 3 weeks. And my candida blew up. And I was craving it. And then when I stopped with the potatoes, I started eating, there's a certain type of bread that I can eat a slice every now and then, but then I was having that every day. And so for me, it's whatever can't process those things in my body. But those are comfort foods for me. So I will reach for them. So I think it's really important to also try to identify when I go to choose that thing. If I have addiction in my background, whether I'm still functional or not, if I'm choosing that thing, and especially if I'm having to justify why I'm choosing it, because I was justifying those potatoes all over the place. They're organic. And so I think we have to look at, why are we reaching for the thing? What is the payoff for that? And it's really difficult in addicts that I've known in my life, because a lot of times they can't really identify the payoff, and they get very angry when you ask about that, the people I've talked to. And so, but I think if they can, and if they hear it from somebody besides a family member and somebody who's with them all the time, they might hear that a little better too, just to identify, like, for me, like the potatoes, it was comfort food. But then I realized, well, it's not comforting me, is it? It's really not making me feel very well. So I don't know. I think addiction is very difficult, and I bow down to anybody who treats that full time, because you have a really, you have a big job, and the person who's addicted and the person who lives with the addict, everybody has a big role to play to get that person to the other side of that. And I think it's all important.
Perfect. Well said, guys. All right. Well, I want to say to anybody who's watching this, if you feel like you have any sort of issue with something that you think you'd like to stop, but maybe you're struggling with, either whether it's just recent or it's been long term, definitely find help. And maybe the first place to go to would be a counselor or somebody who works with addiction, so that you can get into the right mindset, so that you can walk through that cave, that darkness that you need to shine the light on to get to the other side. And we appreciate you watching. And if there's anything we can help you with, let us know. All right. Bye.